Good morning, happy Friday. Always nice to begin our day with you watching 3+U. Hope you have fun weekend plans ahead, and always we hope that you're feeling good as you watch us this morning. But if you are dealing with some chronic pain, perhaps allergies are a problem for you, perhaps a lot of stress, and you're looking for a natural way to ease some of that pain and discomfort, you are in luck, because we're very happy to kick off the show this morning with Jes Fletcher, who has Acu Chatt here in town. Nice to see you.
Nice to see you too.
So I love the fact that you had one career path, and then a few years ago you thought, you know what, I really want to do something that's helping people more.
Yeah.
You're very smart.
Thank you.
So you pursued the Chinese medicine route with acupuncture. And pardon the pun, but one thing has flowed into another.
Yeah.
And you got this thriving business here in town.
Yes, it's been great. Chattanooga's been so welcoming to us. I think it was the perfect place to bring a natural medicine option.
Yeah.
And people do so well here. It's great.
So as we talk, you're going to demonstrate on me, and that's great. Because I've had some occasions this week, actually, true story, with some people I know who have some things going on, and twice I've said, you ought to think about acupuncture.
Perfect.
But people don't always understand it exactly. It's very old.
Yes.
And it's really kind of a common sense approach, I guess, when you think about it, right? Your body is intended to work, and this opens up the flow, right?
Right, and we look at it as the body's all one system. So even if something's bothering you, say in your back, you're gonna feel that in your hands and your feet and probably in your shoulders too. Mm-hmm.
So you deal a lot in your practice, you can do anything, but you treat a lot of folks with chronic pain.
I do, yes.
And then also a lot of fertility issues.
Yeah, when I moved to Chattanooga, I somehow got all the fertility patients and do really well with it. We have about an 80% success rate. We do work with IVF and just natural pregnancies as well, so it just depends on what people are going for.
Okay.
And we help all the way through delivery. So we want to get our patients not just pregnant, but we want to get them a baby to hold as well.
Right. So on the chronic pain side of it for a minute, what does that look like? Does that look like back pain? Can it be nerve pain? What does it look like?
It can be both. So we see a lot of back pain just as people get older and we sit a lot for our lives. You get that compression. So you either will just have local back pain or pain that radiates on your legs. We get a lot of neck pain. Our athletic people here do a lot of shoulders and wrists and knees and ankles. And it's just those injuries that build up over time and kind of flare up when the weather's bad or when you've been too active.
I think what can happen too sometimes with the chronic pain, until it gets debilitating, then you can't ignore it, is that you just kind of think, oh, this is just how I always feel.
Right, it becomes the new normal.
It becomes the new normal, yeah.
Right.
Do you encourage people to consider acupuncture as a maintenance?
Absolutely. So most of the time, once you've injured an area, that's always going to be a weak link in your chain. So we want to make sure we take care of it so it doesn't become another injury or a pain that you learn to live with. But maintenance can look like anything from, most people like to come once a month because they just like the experience.
Yeah.
But it can be once a quarter, once a year. It really depends on your body, how well it holds up.
You also do a lot with allergies, which is huge around here, right?
Absolutely. So Chattanooga has the worst allergies, as we all know, and getting that congestion down is great. But we have a protocol that over the course of about 5 years, we can almost eliminate the allergies that you're facing each time.
Wow.
Which is pretty cool.
So you brought some needles, and she very kindly said you don't have to volunteer if you don't want to, but I do want to. So I guess I'll let you start.
Perfect. Well, I always swab the area first just to make sure it's clean as a precaution. So we're going to do a little needle on your hand right here.
Now, before you do this,
yes,
would there be any reason for you mentioned how the origin of the pain is not always the site where you put the needle.
Right.
So if you put this here, is it possible that I'm going to feel the result somewhere?
Yes. So this point, actually, it's great for facial pain or teeth pain, and it's also really good for back pain. So depending on what's going on, it's a good thing. And so we're just going to go right here, and that's it.
That's it?
That's it.
Now, how long would I leave that in?
Usually about 25 minutes. So we'll do a few more needles in a normal treatment. I usually couple this one with one on the foot, and it actually helps circulation and reducing pain at the same time.
Okay.
And then you just rest. Your job is to either meditate or take a nap. A lot of my patients take a nap. And then they come out feeling nice and refreshed, and their pain is done.
Okay, so let me tell you what I'm feeling as I sit here and look at this needle in my hand that I'm not going to move.
You can actually move too.
Oh, okay. Now, when I squeeze my hand, I could feel it a little bit.
You feel it a little bit, but it won't hurt anything, and usually it's not too painful to move.
So what I was going to say is, when you first put it in, there was a little bit of a jab, but nothing like a finger prick.
Right.
Just a little jab. you feel the sensation, like you know something's there. So there was, for me, a little bit of a mental irritation almost, like, ooh, because your natural thought is, oh, I got to take that out.
Right.
Because you know something's there.
Right.
But you wait 15 seconds and you don't notice it anymore. And like now, as we're talking, it's becoming less and less noticeable.
Yeah.
Is that expected?
It is. Most people after a couple minutes don't even notice the needles anymore.
That is so cool. So if I was with you, you would put one in my hand.
Yes.
And one in, would you put it in the opposing foot?
I actually usually do all four, but traditionally it'd be the opposite foot if you only do one side.
Okay, so I would be like the beginner
Namaste pose.
Yeah, yeah, on the table. So 25 minutes, and then I would be good to go for a month. That's
well, depending.
typically?
Once you're in the maintenance. So the early stages, we do it a little bit more frequently because if you've had pain for 15 years, that's not going to go away in one treatment.
Sure.
So we do what we call kind of build the foundation. So we do several treatments frequently, and once your pain is gone, then we move you into a maintenance plan so you don't deal with it anymore.
Do you work with migraines?
I do, yes. Migraines can be really tricky to get rid of because there's a lot of different causes, but we do really well over a course of treatment.
Okay, I'm just peppering her with unsolicited questions. How about acne?
Acne is treated with acupuncture. It's not my specialty, but it does help, especially when it's hormone related. That's usually where I end up seeing it, and we help balance the hormones so that it kind of disappears that way.
Back to the fertility issues that you deal with. Is inflammation something that you can target? Is that a problem that a lot of us struggle with?
Almost anybody with pain is going to have inflammation, and then truthfully our diets aren't great usually in the US, so there's a lot of inflammation just from the food that we eat.
Right.
And so this helps reduce that as well.
So if somebody makes an appointment with you, is there for a first time appointment, will they be there just about 45 minutes, 30 to 45 minutes, or?
It depends on if they decide to move forward. So usually our initial consults are free. We do about 15 minutes talking about what their symptoms are, what we think we can accomplish together and what it will take. And if they decide to start their treatment, then they'll stay longer. So if they stay the whole time, I say book about 90 minutes just so we have enough time to go over everything.
Okay.
But after that, it's less than an hour each treatment.
Okay, and back on your fertility thing, again, knowing each one's going to be different.
Right.
But if a couple comes into you and you begin the process, will they necessarily stay throughout the whole pregnancy? Is it a case-by-case basis?
It is case-by-case. The ideal is to stay throughout the pregnancy and with different frequencies depending on where you are. First trimester, we do a lot more because there's a lot of hormone shifts and we want to reduce those symptoms. Second trimester is pretty minimal, come in for maintenance, and then we pick back up in the third trimester to prep for delivery.
Okay.
And I actually have a protocol called Smooth Delivery. It starts at 36 weeks and it reduces the pain and intensity and duration of labor.
Wow.
So my labor was about an hour and a half, and I was 5 centimeters dilated when I went in without going into full labor, so it can be really, really easy. I don't think I've had a mom go over 8 hours, actually.
My first one was 45 minutes.
Wow.
Yeah, but it was not fun. All right, so if you're going to take this out, how will you do it?
Just like that.
You didn't feel a thing. Thank you so much.
You're welcome.
So I had a little bit of back pain.
Okay.
I'll see how my 6 seconds or 6 minutes of trying it works.
Yeah.
You can find her at Acu Chatt. Her name is Jes Fletcher. She came here to Chattanooga specifically to open the business. How fun is that in 2019? Right downtown on East Main Street, 708-5651. Do you have appointments on the weekends or just Monday through Friday?
We don't, Monday through Friday, but we do have morning and late hours in the afternoon.
Perfect. So give her a call or go online, acuchat.com. Thanks.
You're welcome. Thanks for having me.
So Simon, your top 15 most memorable auditions.
I couldn't lose one of the acts. We've changed it to top 16.